When we think of humans and sustainability, our impact on the environment is usually what comes to mind. The billions of people that populate our Earth have impacted not only our environment, but have brought about a worldwide healthcare crisis. Many underdeveloped countries throughout the world are at this moment struggling with providing effective and sustainable healthcare for their people. While many developed countries also face similar issues, the scale of the problems don't add up to the severity of the challenges faced by poorer countries. For us to understand these issues better, we will focus on the Central American country of Nicaragua. The nation is representative of the problems many underdeveloped countries face and a testing ground for possible solutions. Nicaragua is the second poorest country in the Western Hemisphere and has one of the poorest health systems in Central America. Most Nicaraguans live on $2 a day, with an average yearly income of only $910. One of the most predominant problems is the high cost of pharmaceuticals. Because of the high cost of pharmaceuticals, many Nicaraguans can't afford to buy their families the medicines they need. For example, something as simple as a bottle of cough syrup costs up to $3 a bottle. Now figure in other costs, like seeing a doctor or antibiotics, and the choice becomes whether to get well or eat. Not only do Nicaraguans not have the income to buy these medicines, but many of these pharmaceuticals are simply not available. A World Health Organization study found that 30% of essential medicines are not available to much of the world's population. In many developed nations, most people enjoy the various technological advancements and innovations found in hospitals and healthcare facilities. In countries such as Nicaragua, many hospitals and healthcare facilities lack in technological innovation and do not have the infrastructure to provide for their citizens. The poor healthcare system within Nicaragua has led to some staggering statistics. Within the country, there are 6 physicians for every 10,000 inhabitants. In the United States, there are 28. Out of every 100,000 women that give birth, 118 perish. In the United States, it is only 7. There are numerous international organizations that are working around the world to improve healthcare systems. The organization Natural Doctors International was established in 2003 by a group of naturopathic doctors.
Like many developing countries, the healthcare situation in Nicaragua is very poor, lacking infrastructure, basic supplies, and medicines.
The goal of Natural Doctors International is to provide primary health care to Nicaraguans by using natural and traditional medicine to combat some of the basic sicknesses that plague much of the country.
I feel like NDI in general provides the basic public health needs, which is to improve the health and well-being of the patients here. And we really do empower the patients by providing a lot of education so that they have the choices available to best take care of themselves.
Natural medicine can be cultivated and grown by anyone. It can be a viable alternative to pharmaceuticals and other expensive and imported drugs from many poor countries. There are many positives to cultivating and using natural medicine. First and foremost, the cost to grow and maintain natural plants are low in comparison to constantly purchasing medicines. Secondly, natural medicinal plants and remedies have virtually no side effects, as opposed to certain pharmaceuticals. Lastly, it is well known that much of the population in these countries are primarily agricultural workers. That said, growing and maintaining natural medicinal plants would be easy for most to grasp because of their knowledge of agricultural production. While providing food for their family, they could also contribute to their health needs and those of the community.
We are working with a group of health promoters around the island and teaching them different ways in which they can serve their communities. One of my projects has been creating a presentation to teach local health promoters how to use some of their local resources to treat really common problems here.
Organizations such as Natural Doctors International are beginning to demonstrate how natural medicine can be a positive force in a global healthcare crisis. The hope is that Nicaraguans can learn and appreciate natural medicine and learn to cultivate and use it properly so that they can become empowered and have the ability to cover some of their basic health needs.
Ha impactado mucho nuestra población, ya que nuestra población prácticamente ha acogido bien esta organización NDI. Hay personas en las comunidades que preguntan qué día atiende la organización de Tabata, y hay mucha gente que tiene mucha fe en ese medicamento que es alternativo para nuestra población.
While natural medicine cannot combat every single sickness and disease, it can help in the prevention of common health issues, which in many underdeveloped countries, due to lack of proper care, can lead to major long-term health problems. While this healthcare idea has yet to be implemented on a wide scale, the example of Natural Doctors International and their work in Nicaragua has shown that this is a plausible alternative that should be further explored. Natural medicine is an economical, renewable, sustainable, and culturally acceptable solution for Nicaraguans in many underdeveloped countries around the world.